rising enlightenment and prosperity. We kindly ask everyone to rise as we warmly invite the following dignitaries to illuminate the land. Keynote speaker, Professor Hemanta Siranayakar, Emeritus Professor of Obstetrics and Gynecology, University of Colombo. Dr. J. Pradeepan, convener for the 8th Undergraduate Research Symposium 2025. And President, Medical Student Union. Speaker, Nanaka and Dr. Jeff Pradeepan to come on stage and take peace and the table. Dr. Jeff Pradeepan, Symposium. A very good morning to you all. The Acting Vice Chancellor, University of Jaffna, Dean, Faculty of Medicine, Dr. R. Surendra Kumaran, Keynote Speaker, Professor Hemanta Siranayakar, distinguished guests, teachers, and students. It is with great pleasure I welcome you all to the Undergraduate Research Symposium 2025, hosted by Faculty of Medicine, University of Jaffna. This symposium serves as a platform for young researchers to showcase their innovative ideas, discoveries, and academic excellence. This year particularly, we are celebrating the 8th edition of this prestigious symposium, a milestone that reflects our unwavering commitment to fostering the research and innovation among undergraduates. On behalf of the organizing committee, I extend a warm welcome to all our esteemed guests who are here today and join online, keynote speaker, respected faculty members, researchers, and most importantly, our undergraduate scholars. Your presence today signifies the importance of research and academic inquiry in shaping the future of science and medicine. Research is the foundation of progress, and the symposium celebrates the dedication, curiosity, and perseverance of our students. It offers an opportunity to exchange knowledge, engage in meaningful discussions, and inspire one another in pursuit of scientific excellence. Our theme, Today's Research for Tomorrow's Care, embodies this concept perfectly. I would like to express my sincere gratitude to our supervisors, chairpersons, evaluators, mentors, and the organizing team whose effort have made this event possible. To all the presenters who are eagerly waiting to showcase your talents, we are excited to listen to 37 free papers today. I congratulate you all and encourage you to embrace this moment, present your findings with confidence, engage in discussion with an open mind, and take pride of your achievements. I'm also grateful to the JMOFA UK chapter in partnership with the Jaffna Medical Faculty Alumni Association for the generous financial support. Once again, I welcome you all for the Undergraduate Research Symposium 2025. May this symposium be a rewarding experience for everyone. Thank you.
Thank you, madam, for your good and inspiring welcome address. We now have the honor of inviting Professor R. Surendra Kumaran, acting Vice Chancellor and the Dean, Faculty of Medicine, University of Jaffna, to address the gathering.
Good morning. Our keynote speaker, Emeritus Professor Kemantha Sennayaka, the Professor of Obstetrics and Gynecology, University of Colombo, and then Mrs. Dr. Kemantha Sennayaka, and the former Dean, Dr. Swapalan, and the present at 8th Undergraduate Research Symposium. Chairman is Dr. Dilip Pradeepan, the Senior Lecturer from Department of Medicine, and other professors, senior lecturers, and also the Vice President of Jaffna Medical Faculty Alumni, students, and well-wishers. Today we are gathered here for this our 8th Undergraduate Research Symposium. So we have to think a little bit of more about why all these medical professionals need research. The research, the simple meaning is the search for the new knowledge. The search for the new knowledge because we encounter that all, whatever the field, whatever the discipline, we encounter many problems and we need to sort out. Even our day-to-day life, we have to sort out these problems that we face for our routine work, and also that we want to always, the human, we always try to develop and improve the quality of care and also that quality of life. So when we want to improve, that we have to create new knowledge. If you don't create new knowledge, that there's no any progress. So always in the era, there are many eras and in the century ago, always the human, they do something to innovate and then discover the new things. So we have to, if these people don't discover a new thing, then we won't progress. So research actually for the creating knowledge first. So when you take this medical profession, there are changes happening. It's happening just very rapidly. So when you take that a few decades ago, and when we were like you, that's the medical practice was totally different. Now the medical practice is changing, and also a lot of new diagnostic and then the treatment methods are introduced every day. And then the world is changing with these digital technology, AI, and then even the future of quantum computer. So then we want to create some kind of a similar kind of a machine to provide the services and things. That's the way this world is moving. So we can't now talk because the world is moving, so we have to move with it. Otherwise, we will be like failed people. So the research, the knowledge creation, all the medical professionals are expected. So what's the problem we are facing? Even we don't know our normal blood pressure. We don't know our normal cholesterol level. So we don't know about, so we are all treating, even some of the medications, the dosage. The people are taking daily some of the medications. The doses are research done in, right, some of the countries using some of the human subjects. So whether that is applicable for Sri Lanka. And also now you see this our genetic makeup, our environmental and all these things are not same as the people living even in South Asia, that even in different communities. Even in Sri Lanka, it has its own diversity. So in this context, the research is a key. So unfortunately, our higher education institutions because of the way that is evolved and also the limited human resources, still our focus towards research. Even this among the practitioners, it's a focus about research. We think about that when most of our research, like you do now there's 200, 300 samples with that and doing that research. It may be not create small knowledge, but it won't give any kind of a new knowledge for us to develop our own practices and guidelines. So it's a time for us to think and change the kind of a setup. Otherwise, Sri Lanka will be like always the kind of a developing country. So I said this research is for the knowledge. Now this research is for the development. So if we are not involving in research, we can't develop our services. We can't develop our new technologies. So we have to always depend on the technologies coming from the developed countries, so the global north. So most of these research publications are coming from global north. So 90%, more than 90% of these publications. So we have to see that how we can make. So that is what that we introduced this. So this is the eighth, right, consecutive year this conference is going on. But we need to analyze, let's see this after introducing this undergraduate research symposium, how it's kind of created an impact and how many of our newly graduated doctors are really interested in doing research. So that may be one of the things that one of our academic team can take it up and to produce kind of a thing. But I'm urge here that you as a kind of undergraduates, you are embarking your journey as a medical professionals. So better you think today. Forget about that past. Think today and see that how you can develop that. We don't sometimes with this, we don't need additional funds. The only problem that we have is still we rely on the paper-based medical records. If we have electronic medical records, simply we don't need funds, many funds, since we can produce a lot of evidences. You know this the magic number that HbA1c7 came out from UK PDS. It's all general practices, UK general practices data. So they analyze and then come up with the guideline. So we all are practicing that as a guideline. There's a mantra for all of us to treat. So that we don't know whether it's a maintaining 7 is good or bad, right? So even the blood pressure, right? We don't know. Sometimes the people get when we overdrink, and particular old age people, they can develop this hypertension. Then already they have a potential to have a fall, so that this may increase the over medication. So all things we can do when we do good research, even at our practice level, but that we can join and make. But there are need for new devices and to support, because our population is aging fast. So one of the fast aging population and birth rates are coming down. So the total birth rates earlier it was 360,000. Now it's 242, 250,000 last 4 or 5 years. So that means that we are going into the another phase of demographic transition. And also already we are working on this epidemiological transits, lot of chronic disease, and now we are moving towards neurodegenerative diseases. So we should able to have a kind of a locally developed evidences and solutions to solve all these issues. We can't wait for this something coming from US or Europe or maybe or China. Now there's a growing this fast growing country because they spend a lot of money to develop R&D. So the same thing that we have to do, and we have to have a mobilized you. You as a future of this country. So you still this you have a time to develop you, and I hope that this undergraduate research symposium will stimulate you to know get into this kind of a path. That part of your care it should be incorporated that the research. And second thing that today topic is also related to that, and as mentioned our chairperson that today research is for the tomorrow's practices. And also that I will talk a little bit of Professor Hemant Seneka. His talk will give more kind of information that his extensive involvement of research ethics. So when we are carrying out the research, then we have to do it ethically. So there's a clear demarcation when we are treating the patient and when we are using the patients to do the research. So because the patients are coming and they are getting benefit, but when we are using this research, we are not sure whether that is going to give real benefit or not. So in that context, following the good research ethics and practicing is very important. So then Professor Hemant Seneka and all tried to develop. When I was discussing, he wanted to develop on this Pundergite, this photogram to incorporate in these normal pregnancy record that we follow for these all the antenatal clinics. So he said that he was not able to make it. He got some research people to support, but he received finally is partially filled forms. So they're all practitioners. So the practitioners are not now they are not realizing how that's locally developed, right? This nomogram, how that is going to help improve the care. So that's the reason that we want to have a undergraduate research symposium. And thank you, sir, that for accepting our invitation and coming all the way from Colombo. So unfortunately, today Vice Chancellor got some urgent work in Colombo and he is not able to make it. So thank you, everybody, that particularly organizing committee and other members for your contribution to organize this and the tireless effort to make this event successful. Thank you very much. Have a wonderful day.
To unlock new horizons of knowledge, guiding us towards a path of growth, understandings, and innovation. Thank you, sir, for sharing your vision with us. It is truly insightful and will greatly benefit us as medical students.
Next agenda is the introduction of our keynote speaker. I kindly invite Professor Hemant, Professor of Physics and Gynecology, Medicine, Jaffna, to introduce our esteemed keynote speaker to the audience.
Good morning. The keynote speaker, Professor Hemant Seneka. He actually graduated from the Colombo Medical School in 1978 and was board certified as a specialist in obstetrics and gynecology in 1986. After joining the Department of Obstetrics and Gynecology at the Faculty of Medicine, University of Colombo, he held several important positions and was the chair professor of obstetrics and gynecology at the time of his retirement. Currently, he is the president of the Asian Society of Endometriosis and Adenomyosis. This society is a rare post held by a Sri Lankan. Endometriosis and adenomyosis being a rising disease in women. This society covers almost 60% of the world population. And also, he was the founder president of the Endometriosis and Adenomyosis Association of Sri Lanka. He has been a long-standing member of the Board of Study in Obstetrics and Gynecology at the PGIM and was instrumental in streamlining postgraduate education in obstetrics and gynecology and has served a term as the chairperson of the Board of Study in Obstetrics and Gynecology. He is the past president of the Sri Lanka College of Obstetrics and Gynecologists, Obstetricians and Gynecologists, and the Perinatal Society of Sri Lanka. And during his presidency, he played a pivotal role in making the PPIUD or the postpartum IUCD program, along with the FIGO or the International Federation of ONG, a success, which later became an acceptable and approved method of contraception in Sri Lanka, which is practiced throughout the country. He has constantly worked towards training in obstetrics, emergencies in obstetrics and gynecology for all medical personnel involved in carrying pregnant women. And currently, he is the director of emergency obstetric course of the Ministry of Health. Even yesterday, after coming to Jaffna, without wasting his time, yesterday morning, he spent the whole morning with our SHOs and registrars at the hospital doing an emergency training session because he's so passionate about that. Professor Senanayake always advocated respectful maternal care and women's right with regards to women's health. And in recognition of his work, he is the member of the steering committee of the White Ribbon Alliance, an organization that advocates for respectful maternal care. And also, he is the member of the subcommittee for women's health and human rights of the International Federation of ONG, and also the technical advisory committee member for maternal health in Southeast Asia of the World Health Organization. He was the chairman of the Research Ethics Committee at the Faculty of Medicine for almost 10 years, and we know how difficult that job is. His research profile is exceptional and extensive. I don't think I can mention everything in this few minutes given to me. He has got more than 70 publications in journals listed in PubMed, and his research has received over 1,500 citations with an H-index of 20, probably the highest H-index for a general obstetrician and gynecologist in Sri Lanka. Professor Hemantha Senanayake has also authored several chapters in textbooks published by reputed international publishers. And he has also received 3 presidential awards for research. He's a member of the Board of Trustees for Stop Child Cruelty 2020, an organization that advocates for legal reforms to make corporal punishment of children a punishable offense. In 2004, he built a preschool in a remote village in Anuradhapura district. And so far, almost 950 children have passed through this school. On a personal note, I met Professor Hemantha Senanayake long time ago, maybe in 1998, when I attended preparatory course for MS Part 1 held at De Souza Hospital in Colombo. I was the post intern working at Base Hospital, Avissavella as an MO-OPD. Later, I had the opportunity to work with him in the SLCOG, especially the PPIUD program, the Board of Study, and also as a academic colleague. He has visited Jaffna several times. This is not his first visit to oversee the PPIUCD program at that time. And also whenever there was a safe motherhood program held in Jaffna by the Sri Lanka College of Obstetricians and Gynecologists. Something which nobody knew during my early days in Jaffna, he has helped us with complicated and complex procedures done for young female children who are born with congenital genital abnormalities, which nobody does in Sri Lanka. So we together prepared patients, and I used to send to him, and he used to operate and send back to me. And very recently, a girl who was operated by him as a child came to meet me with her mother. She's actually from Trincomalee. Just to see me, to say that her daughter has got married. So we are very grateful to him. He's here with his wife, Dr. Samanthi Premaratna, who is a gynecological oncological surgeon working at the Apeksha Hospital at Kayans Institute, Maharagama, treating gynecological cancer. Professor Hemantha Senanayake is respected not only for his academic excellence, but also for his modesty, willingness to help others, and also for his straightforwardness. So as the faculty and the medical students, we are very fortunate to have him as a keynote speaker and also the chief guest for this undergraduate research symposium. Thank you.
Do you need audio?
No. No audio.
So good morning, everybody. And thank you, Dr. Mohan, for that very generous and very kind introduction. The acting Vice Chancellor, Dr. Surendra Kumaran, the convener here, Dr. Pradeepan, and the organizing committee. Thank you very much for honoring me with this invitation. I feel really honored. I'm humbled. It's a great pleasure to be in Jaffna once more. I'm very happy to stand here today because I see so many young people very smartly dressed, and thank you for taking that trouble. You look very smart from here. So I really thought I'll share with you some stories from history of medicine, which I thought I'll wake you up with that stories, with my stories. But I really want to start off by making a plea to you. Please consider publishing your findings in a journal. You might be a medical student, but I'm sure your ideas are better than the ideas coming from old people like us. Your minds are fresh, you're questioning. So don't underestimate your findings. So think about it. That's my first thing I want to tell you. You're putting a lot of effort in the middle of all the other work you're doing. And I will try and tell you how you can set about publishing your work as well at the end of this talk. But please remember that. And I will start off with a good example. So can I just ask for a show of hands, How many of you have done your obstetrics appointment? Nobody has done? A lot of people have done. Oh, very good. So you know the kind of things that we do. How many of you have seen an episiotomy being given, not sutured? Nobody has seen? You are not spent in that. Okay. Are you only a few people have seen an episiotomy being given? Okay, good. So here's my story. This is something that I have been interested in since I did my first presentation as a young senior lecturer on this in 1993 in the SLMA sessions. You know, what was happening at that time was women used to be given the episiotomy as a routine without anesthesia. Those of you who have been to the De Soysa Hospital, you know, we have a road running very close to the hospital. And then if you're on the road, you can know when a woman is getting the episiotomy because you can hear the scream there. So I used to kind of rebel against it, and I used to really, you know, wanting to do something about it. And I asked my senior colleagues, so, you know, is this right? You know, do you want your sister to go through this? You know, like this. So this is the Hemant, you know, if you do it at the correct time, the woman doesn't feel the pain, you know. So I asked this gentleman, so sir, when is the correct time to do it? So they said, no, the correct time to do it is the correct time to do it, you know. So that was the answer. Anyway, so what I wanted to tell you was, you take a look at it. This is in the Ceylon Medical Journal, which is appearing in the PubMed. It's an index journal. It's peer reviewed. It's not easy to get an article in that. But what I wanted to highlight was that this is from a student research that I did. They presented it in our symposium. And this is what I wanted to do. This is well within your reach. Okay? We'll talk about the details later. But actually, see, this is the power of research. This is what the acting vice chancellor and dean was telling you. You know, your research has the power to change lives. Your research will have the power to do something good for the society. Like I said, you know, did you really think about your sister going through an episiotomy without local anesthesia? I'm not talking about the suturing. I'm talking about the moment it's given. I think it's barbaric, really. But I'm very happy that as a policy, your professorial unit is following a policy of giving local anesthetic before the episiotomy is done. I really want to congratulate my friend here for taking that kind of stand, because there are some regulatory problems with that, but that's not relevant for us. But remember, you must try to publish your paper. So I've been in research ethics for a long time, but I thought I would just talk to you about some, you know, anecdotes from history. But this is what they say about research ethics. It's born in scandal. So if you have a scandal, then you go and change something. That's how it's born. So we talk about Edward Jenner. People here might not know it because he found what is called vaccination, the way the name comes from what he did. Me being from a very old generation, I also had this vaccination for smallpox in the 60s when I was a child. You won't have that scar in your forearm. But he saved countless lives. And I still remember when I was a medical student, when they declared the word free of smallpox. That's the disease. It's something similar to chickenpox, but it's lethal. You die of it. Now, let's look at what Jenner did. Jenner was he discovered the vaccination in 1796. And like I said, it saved countless lives. And what happened was that he was a general practitioner in a farming area in Wales. And he found that during this epidemic, people who worked with cattle, dairy farmers, didn't get chickenpox. So he thought there might be a connection between chickenpox, there's a smallpox, and what is called cowpox. So you get a similar sore, like a vesicle, in the cow, and that has a serum which contains the virus. So he thought there might be some kind of immunity that developed in these workers, dairy farmers, when they came in contact with these cowpox sores. So what he did was he inoculated an 8-year-old boy with serum from a cowpox sore. Those days they didn't know about viruses. Okay, no electron microscopy, no ELISA tests, nothing, right? And so what he did was, scientifically, what he did was right. He wanted to get somebody who was naive to the virus. So you can't get somebody who is 70-year-old who's working on a farm for a long time, because that guy might have the immunity anyway. He chose a child, and he inoculated him with that's serum from a cow's pox. So then, after some time, Edward Jenner takes serum from a cowpox sore now. Proper smallpox sore. This is the lethal stuff. He inoculates this 8-year-old child with the serum. And he is now sitting and waiting to see whether the child will get smallpox. But he was very sure. Because the thing is this. Now, James Phipps was the son of his gardener. So there was a power hierarchy there. So the gardener can't say no to Edward Jenner because of the power hierarchy. He might lose his job, his family might starve. Those days, Britain was not such a rich country. So power hierarchy. And then he's inoculating James Phipps, who is a minor, 8-year-old child, who can't give informed consent. Okay, so this is an interesting scenario. So imagine if his experiment failed, he would be liable to murder charges if James Phipps died. Fortunately, James Phipps didn't die. And then Edward Jenner went to the Royal Society of Medicine and presented his findings. They say, no, this is not going to work. M equals 1, that's not good research. You better bring us more results, more experiment with more children. So he goes back to his village, and then I think he inoculated 11 other children. And the interesting part is that he had an 11-year-old child also whom he inoculated, his own child. Okay, interesting stories. So look at this, the equation. This saved countless lives, but if it goes to your ethics committee today and somebody says, I want to do this kind of experiment on children, it will never be allowed. It's not ethical research. So there's a story about research like this. So Jesse William Laser is a Harvard graduate who was supposed to be known as a brilliant doctor. And he was tasked with researching an epidemic of yellow fever in Cuba when Cuba was part of the United States. And he went there, and he was married then, and he writes to his wife, I think I'm on the track of the real germ. What happens next? 17 days later, Jesse William Laser is dead with yellow fever. Okay, so then there's an investigation, and then they found that he had inoculated himself with the virus to study its progress. Okay, yellow fever is colorful disease, right? There's a lot of stories about yellow fever. And then the investigation found that he also had a precondition for joining his research team. That is, you have to inoculate yourself with the virus to see what happens. Later, a man called Walter Reed, 3 years later, was commissioned to study the epidemic in Cuba. And he laid down the conditions, proper research, inclusion criteria. Only adults would be recruited, and he drew up a contract, which was a written consent, the first proper written consent form for research. I'm sure in your research also you used a consent form. So here's the origin of the consent form. But this is the interesting thing. I do a lot for $100 today. So what his contract was that if you participated in the research, you get $100. And if you caught yellow fever as a part of that, you get another $100. So if you go back, if you go back 100 years, you can buy an acre of land for 25 cents, So put it in context. So here's another principle we talk about in research ethics, and that is inducement versus compensation. Say, for example, I remember one project that came to us. Somebody was studying people who are working in quarries that breaking stones, and there's a lot of dust, and they wanted to see lung disease, the prevalence of lung disease among people who were working in quarries. And so they had to come for an X-ray. So what we said was, you got to pay the man or woman a day's wages, give them a lunch pack, nothing more. Okay? So because we are not inducing them, then it's not an experiment like that, but then we have to compensate, right? There was another study that came to us, which we didn't accept in that condition, something that involved bronchoscopy. And the doctor who was recruiting the patients for bronchoscopy for this experiment would be given 20,000 rupees as fee for recruiting patients. And we said we can't accept that condition. So little things in research that matter. So the Nazi experiments take the cake, don't they? Really? Because it had no relevance to general health, but it had all the relevance for their war effort. If you look at this picture, you can see here the ice cubes here at the bottom. So this is an ice bath. So this man is being immersed in there. The purpose of the experiment was to see if one of their pilots ejected in the North Sea, which is a very cold place, how can we make them survive longer for the rescue team to go there? What can we do to make them survive longer if the rescue team can't get there? Okay, that was the only purpose of that experiment. It had no relevance to anything else in life. Some of the Nazi experiments were so bad. Now, say intrauterine injection of silver nitrate, saying there is a routine examination, and these women were told we are doing something to, take on infections off. And then you see silver nitrate, if you inject it into the uterus, you get the whole thing getting stuck together. That is like a sterilization. So they wanted to see how effective that was. And many of these women ended up totally sterile if they survived that the gas chambers and all that. Here's another one, high altitude experiments. He is a man. He's in a decompression chamber, so they keep reducing the pressure, taking the air out, etc., etc. They are making measurements, and then to see how the man would survive. Again, to see what they can do with their pilots. How can a pilot go? How can the person go without compressed air? The bad thing, it doesn't end there. Some of these people, now these were all prisoners. And some of these people were killed after the experiment to see what it did to the liver, the kidneys, and everything. Okay, so here's the thing about it, because now if one of the prison guards went to this man who is in this picture and said, look, you're going to kill it day after tomorrow anyway, why don't you do something for humanity and take part in our experiment? Is that informed consent? So in the Nazi experiments, they did some terrible things. They experimented with poisons, and there were no antibiotics then, So they would create a wound and put some dirt in the wound and give them sulfonamides and then check whether it would get infected, etc. So some terrible things were done. Biological warfare experiments, etc. And here is a picture from the famous Nuremberg trial in 1948, which tried these people who were, about 1947, which tried these people for crimes against humanity. There are some, if you're interested in the Second World War, so there's some of the famous names from there, Himmler and all these people. So the Nuremberg Code, the first code for research ethics, came as that was the third part of this judgment. So they laid out 10 principles of ethical research. This is going a long way back, but here's an interesting thing. But one of the main things was that voluntary consent of the human subject is absolutely essential. Let's see how where informed consent is today in the research hierarchy. But then unethical research continued. Even in the United States, they thought that, all these research ethics rubbish is not for us, it's for Germany and Russia and places like that that did unethical things. So this man called Henry Beecher, he studied 22 papers with questionable ethical backgrounds. This came in the Lancet, mind you. It's one of the biggest journals, which is a very reputable journal, and all conducted by reputable people, right? It was a landmark publication in research ethics. And he said most of the problems with these papers was because there was thoughtlessness and carelessness. But it's not that the researchers disregarded the respect and dignity of the participants. So that's something for us to remember. We can easily do unethical research if we are not careful. And we talk about some of the traps you can get into. Here's one of the studies that he wrote about, the Willowbrook School for Children with Mental and Motor Retardation. If you know any patient or any friend or somebody who has a disabled child, you know what they go through. So here, this is in the America in the early 60s, not very good economically. These parents were finding it very difficult. They had only places like this to get their children into. So it's known. And then, I think you all will be given the hepatitis B vaccine when now these days, But there was no vaccine for anything those days, any of those hepatitis viruses, Even when we were medical students, there was no vaccine, right? And so invariably, these children got infected. So what they said was, we are going to inject the child with the hepatitis virus because invariably they're going to get infected. So why not give it early and see what happens? So one of the preconditions for the children coming into the hospital, right, was they closed the school for new admissions, and they said, okay, only if you agree to this, we will take your child. So basically, I want to tell you that some of these actually showed us how these diseases developed, but it was unethical research. Here's a classic example of what is unethical experimentation, Tuskegee trial, and I think it should be anybody who is interested in general knowledge would have known about this. And in the Tuskegee trial started in 1972, they basically studied syphilis. Okay? And I want to tell you a lot of the things that we know about tertiary syphilis came from the Tuskegee trial. Look at the ethics of this, right? So a group of 400 men with syphilis and 200 healthy controls, They were offered free treatment, but the only free treatment was taking blood for testing to see how the disease is progressing. Okay. Because subjects were not told, they were getting blood and everything, and they continued. And the death rate amongst the people, the study group, was twice that of the controls. And what was important was that these were almost exclusively Black men. Here's another thing. You know that penicillin works very well for syphilis, and it was commercially available from 1952, and the trial continued for another 20 years, 2 decades. But they had done similar experiments in other countries as well, and the US apologized to them. Even more recently, there have been deaths in relation to research. Yes, from the Johns Hopkins University in the US, a prestigious institution, and they tried to treat asthma by getting people to inhale hexamethonium. Ellen Roche was a 24-year-old volunteer who actually worked in an office in Johns Hopkins. And apparently there were inducements given to people who participated in this. And Ellen Roche actually had gone and participated in her lunch break because she saw all these notices. They pay good money for research participation. But then she died. And then Johns Hopkins said they were institutionally responsible for her death. That's another thing. I just wanted to tell you, there's nothing called risk-free research. So when you're doing a research, let's say you're going and doing somebody pain relief or whatever in a post-operative patient, unless you're having a good reason to do it, a good method for doing it, it's not ethical. So everything that you do in the name of research has a certain element of risk, loss of income or whatever. For example, if you're looking for, let's say you're doing a study on genetics and then you find that somebody has a gene for Alzheimer's. Okay, what do you tell that person? So we have I'm very interested in endometriosis, like you heard. And then we are now doing projects on adolescent endometriosis. So we know that endometriosis begins in the adolescence, So it's relevant for the ladies here as well. If you're having a lot of pain, get a checkup done. But then what are the implications of telling a 16-year-old you have endometriosis? What about the psychological aspects of it? Will she be depressed and, despondent for the rest of her youth, thinking she can never get pregnant, that she might have to have hysterectomy surgery, So we need to look at all these things. It's not enough. So now, this is the crux of the thing, isn't it? Why should you, as a doctor, engage in research? There are many reasons for that I can think of. This is not from the internet as such. These are things that I'm thinking of. One thing is that it will make you an expert in the area that you are researching, because any research project will begin by your reading extensively on that subject. This month, for our ethics committee, 3 projects on endometriosis where I am involved went into our ethics thing. 2 of them was, I didn't understand a word of it. If somebody was looking at microRNAs, other one was looking at the microbiome. I didn't understand a thing about it. I pretended that I understood it, but they know much more than me on that aspect. So it will be the same for you. You research it extensively, and you will know more than anybody else in that area. It will make you. That's very interesting. It's a journey of discovery research. Okay. So with that knowledge, it will encourage you to do evidence-based medicine, and also it will give the evidence for other people who are practicing medicine. Say, take that study, medical student study on episiotomies, right? I think that paper helped a lot to change people's mindsets. the Ministry of Health. They didn't realize this was happening. They didn't realize that there were problems with it, So it helped to change the barbaric practice, but I'm sorry to say it still happens in certain places. Right. You can develop new treatment methods, diagnostic tools, and preventive strategies. We talked about the old age people. Can we have a preventive strategy of educating older people to build up their muscle mass, which will help them with their mobility, then the cholesterol levels, the risk of diabetes, all those things, the muscle mass, as you know, matters a lot. Do we educate our people about it? These are simple things that you can do, really. And that can be life-changing. Professional development is very important. I'm keep going back to that paper that our students did, and I know that at least one of those people joined the university, and that paper helped her immensely to get into that university. Also, people will recognize you. Your name will be on the internet and in prestigious journals when you are a researcher. So professional development, and then also it makes it easier. And yesterday we were talking about how our health ministry is going to get saturated with doctors. So it is going to get more competitive, So in that competitive world, this will definitely give you an edge. And I think really things will change, it will become very, very competitive. So think about that, right? Of course, quality improvement, you are improving quality of what you're doing, and improve things for others. You change other people's lives. And you can recognize unmet clinical needs, etc., and make a difference. So really, when you think about it, every drug, every technique, is there today because somebody took the trouble to go and experiment it. You take anything, magnesium sulfate in pregnancy, we use it and it's life-saving, simple drug. When we were young doctors, I remember medical students, eclampsia and severe preeclampsia used to be treated with something called the lytic cocktail, which contained promethazine, pethidine, and something else. And none of these were anti-epileptic. Okay? Somebody bothered to go and change the lives of so many people by going and experimenting with this magnesium sulfate. Take tranexamic acid, we use it today for postpartum hemorrhage, right? You've seen it being happening. Okay, that experiment was done within the last 10 years, I believe. Okay, and so people did multi-center studies, took a lot of trouble because it was happening in every other field of medicine. It was from the battlefields to prostatectomies. Then they came into obstetrics, and see the difference it's making. Saving lives, saving mothers for their children. So I think this is for me a very important reason. It will make you feel good to see your name. You see the title of your research and your name as the first author, and it's there on the internet, it's there on that journal. It will definitely make you feel good, right? This is something that made me feel good, right? So all of you guys who have done obstetrics, you see the woman screaming in pain and somebody going and catheterizing this woman. Have you seen that? Cesarean section, you do a catheter. Okay. And I published a paper arguing that you don't need a catheter to do a cesarean section because, in fact, in my discussion, I wrote a sentence which was quoted very often after that. I said, obstetricians seem to have an emotional connection with the catheter. I don't know if it's true, but anyway, I said that it was quoted very often in some other articles. So this is a kind of a systematic review which came in the BJOG, it's a huge journal. And then, Lewis found 3 articles that were worthy of consideration in this, and then made me feel really good my name is there. My article was one of the things that they chose to do that. And for 20 years, 25 years now, I have done cesareans without a catheter. And that's what I published on a simple study design and makes you feel good. And I would really want you to. So here's the thing. I told you, please consider publishing your research. Okay. What are you going to do as a young medical student, right? First of all, evaluate the relevance of your findings, like the episiotomy. If you did something on telling 70-year-olds do 50 squats for a day or whatever, the effect of squatting on muscle strength of 70-year-olds or whatever paper, and then you have your name, underneath that, it's a good feeling. But first of all, just see how relevant is it? What you've done, what you have done, what you're going to present today might have a major relevance for people of Jaffna, the country, and the world, right? So see how strong your findings are. You must have had some stunning findings. This is the thrill of doing research, because as the data is coming in and you're analyzing it, you're seeing, oh my God, we are seeing something here, Okay. For you, I believe one of the things you can do is approach a mentor. It might be the supervisor who helped you to design the study and conduct the study. Do that, approach your mentor, because that person will have experience in writing. When you are writing, so first of all, target a journal. Don't feel shy, think about the Lancet, or, write to a good article, good journal. They might say, very sorry, we can't accept your paper, but they will send you reasons why they are not publishing your article. In the next version, you can address those and then publish it to another journal, submit it to another journal. Writing an article is not easy. For me, if somebody says, look, sir, I have written this article, to me, that guy is telling me, or that lady is telling me, I have the discipline to do this. I want to give that man a job. This guy is disciplined. So he had the discipline to write it, rewrite it, and correct it, put it through Grammarly, spell checkers, everything. So, like I said, don't get put off by rejections. Okay, so keep trying. That's this thing. Don't waste your findings. Write it. So, because you have done the research and you are here because you have done the research, I want to give you this bouquet of flowers, okay, to greet you. Okay, so I think you have done the first step, the most important thing. So once again, I want to thank the University of Jaffna, the Faculty of Medicine, and the organizing committee for giving me this pleasure, this privilege, and this honor of being here today. I hope you will find research interesting. I hope I have inspired you to do research. It's never easy, but it's always very rewarding. And with that, I want to wish you all the best in the future. May the Faculty of Medicine in Jaffna go from strength to strength. Keep looking smart. Thank you very much for listening to me so patiently. Thank you.
Hi, to do something is the correct time to do it. Thank you, sir, for graciously sharing your profound expertise, enriching this event, and leaving a lasting impression on all of us. Your insightful words have been truly inspiring, and as future doctors, we are deeply grateful for the invaluable knowledge and wisdom you have imparted.
Kindly invite speaker.
For the official release of the symposium proceedings, we warmly invite our convener, Dr. J. Pradeepan, to formally release this year's proceedings.
We also extend a kind invitation to our esteemed chief guest, Dr. the portfolio of the symposium proceedings.
Thank you, sir. We kindly invite our dean to receive a copy of the proceedings. Thank you, sir.
I take this opportunity to inform the audience that the proceedings are available on the faculty website and can be accessed freely by scanning the QR code on the screen.
This is the moment to honor our young researchers for their outstanding achievements in research across various fields in 2024. We invite Dr. E. A. D. Kunjul, Head of Department of Community Medicine and Family Medicine, to announce the award winners. We kindly request the winners to come forward and receive their awards.
Present the Research Awards. We kindly invite our keynote speaker, Professor Hemant Senanayake, and our meeting district certificates and medals.
Good morning. Research Awards for 42nd batch students. Velayudhar Sodhinathan Memorial Award, which award is awarded for best research in the field of microbiology for the research titled Knowledge on Ownership of Dogs and Prevention of Rabies among grade 10 students in Jaffna Education Division. The students are Niveda Muralidharan, Madhushanti Indrakumar, Shobhika Sivanandan, Kajavani Jnanendran, Veerasinghe Patralage Harshan Iranga Rajapaksha. Thank you. The next award is Dr. Muruganandan Award for Best Research in Mental Health. This research award is given to the research titled Body Image Dissatisfaction and the Social Anxiety Among Medical Students of University of Jaffna. The winners are Nilani Sivarasa, Kushika Patmaraja, Sundarapurama Mudaliyan Sulagi, Sugita Harshana Bandara, Kulindran Indushan, Disanayake Mudalige, Deshani Udari Madhushika. Thank you. So next one is Kovindapalli Kandaya Research Award for the best research awards based on our assessment on their report. It's given to three groups. First group, the research title, Awareness on Burn Injuries, First Aid and Associated Factors among Students of National Education College in the Northern Province of Sri Lanka. The students are Nushad Fasila Begum, Karnanandan Abisha, Jayavira Mudyansalage, Chamot Tarendu Madhushan Jayavira, Disanayaka Mudyansalage, Kumbure Gedara, Shashika Dilrukshi Disanayaka, and K. Diswan Tibaraga. Thank you. The second group on Kovindapalli Kandaya Research Award for the research title Knowledge, Attitude and Practice in relation to worm control and associated factors among mothers of children admitted to pediatric wards teaching of Jaffna. The students are Muhammad Jawad Jasara Hashmant, Nenamaralage Sachini Satsarani Bandara, Kodiswaran Vittagan, Disanayaka Mudyansalage Mudushi Lakshika Disanayaka. Thank you. The third award on Kovindapalli Kandaya Research Award for the research title Awareness of Oral Cancer Disease and its Risk Factors among the Adult Patients in Outpatient Department of Teaching Hospital Jaffna. The winners are Ilakya Kediswaran, Ilamburi Devage Hiruni Chamika Vijay Bandara, Kobinathan Premakandan, Navarana Raja Atmika, and Puvanendran Kajan. Thank you. The final award is Professor Appukutti Sinnathambi Award for the best research in reproductive health is awarded to the research titled Miscarriage, Related Factors and Management among the women with miscarriage admitted to the gynecology wards of Teaching Hospital Jaffna, awarded to Sivabalan Pavitra, Sivanandan Mayuran, Samarasinghe Arachige Melani Bhagya Chandrasekhara, Muhammad Isaac Fatima, and Shanuga Amridalingam. Thank you.
Finally, it's time to express our gratitude to everyone gathered here. I now invite Mr. Rahul Khanna to the platform. Patience when the thanks.
Good morning, everyone. It's my great privilege to extend a heartfelt vote of thanks at the conclusion of the 8th Undergraduate Research Symposium. First and foremost, I would like to express our gratitude to our Vice Chancellor, who enabled leading us today has been a constant source of encouragement and support for academic endeavors like this. A special thanks to our keynote speaker, Sir Semanayakar, for accepting our invitation and sharing your invaluable insights and expertise. Your words have truly enriched our understanding of research and its impact on future healthcare. Our deep appreciation goes to the Dean, Medicine, your unwavering support, which has been instrumental in making this event success. I am also grateful for the generous financial support extended by the Jaffna Medical Faculty Overseas Alumni in United Kingdom in partnership with the Medical Faculty of Alumni Association. To all our distinguished guests, senior professors, and the consultants and the teachers, your presence today signifies the importance of the research in shaping the future of healthcare. A special mention to our supervisors and reviewers, your guidance and a constructive feedback have played a crucial role in refining the research projects presented here. A heartfelt thanks to the chairpersons and the evaluators of the paper presentation for their meticulous assessments and encouragement, helping our young researchers enhance their academic journey. This event would have been possible without the tireless efforts of the URS committee and supportive staff. Your dedication and hard work behind the scenes have ensured the smooth execution of today's program. To our colleagues and seniors, your enthusiasm and participation have made this symposium truly engaging and dynamic. We also extend to our gratitude to the technical support team and handling lights, sounds, as well as the visual media photography team for capturing the essence of this event and ensuring everything seamlessly. Finally, a big thank you to each and everyone who presented here today. Your engagement and support to continue to making this symposium a meaningful platform for academic discussion and growth. With that, I conclude this vote of thanks, looking forward to seeing the impact of today's research on tomorrow's care. Thank you so much. Thank you, Alvin. We have come to the end of the inauguration of URS 2025. We kindly invite our guests for refreshments at the boardroom.
The refreshments for the students will be served in the campus at the auditorium. By the student presentation, parallelly held at the following venues: Panel 1, auditorium, Panel 2, lecture hall. Finally, it was venues at 10:30 a.m.
The research papers will be evaluated by experts, and the winners of the top 3 places will be awarded medals and certificates. We kindly ask you to gather for the awarding ceremony at 2 p.m. in the whole auditorium. Thank you all. Have a nice day.